So why does exercise even matter? Why are we having this topic of discussion? Because and especially for metastatic breast cancer, exercise plays a crucial role in improving the overall well-being of individuals living with metastatic breast cancer. Despite the advanced stages of disease, engaging in physical activity is both safe and beneficial. Research and clinical guidelines from many reputable sources like American College of Sports Medicine, Macmillan Cancer Support, um, highlight several advantages. And the advantages are actually listed right there. And I already talked about them, so I'm not going to go over in great detail, but it reduces your fatigue by almost 50%, enables you to sleep better, and preserves physical strength, which is very important because of the undergoing treatments. Sometimes you have decreased bone density and you experience a lot of weakness. So exercise will actually help combat that. And a lot of times there is a misconception that exercise is going to make me feel more tired. But if you are doing it in a very structured manner, it has the opposite effect. It is going to help you feel less tired. So I know that this is a commonly asked question. What kind of exercise is safe? When living with metastatic breast cancer, choosing the right type of physical activity is essential to ensure safety and effectiveness. Low impact aerobic exercises such as walking, swimming, and cycling are generally recommended as they are gentle on the joints and bones while still providing cardiovascular benefits. These activities help improve stamina and reduce fatigue without placing undue stress on the body. Gentle strength training like using weights, light weights, or resistive bands, can also be beneficial for maintaining muscle mass and functional strength. Stretching and balance exercises, including yoga and Tai Chi, promote flexibility and reduce stress and enhance overall well being. It is important to tailor the exercise to keeping in mind your medical conditions, though. For instance, patients with bone mets should avoid high impact or strenuous activities that could increase the risk of fractures. And consulting with a physical therapist or a cancer rehab specialist or a medical doctor before starting on an exercise program is extremely important, especially if you have mets to the bones. So, how are we going to get started? So the first advice I would give is set achievable goals. Begin with small, manageable goals, like for instance, a 10-minute walk to build up endurance gradually. And even if you cannot do 10 minutes, I'm going to actually kind of demonstrate how we can get to 10 minutes. Always track your progress. So that's what I was talking about. Whether you want to use your your phones, or you want to have a journal, every single day, I would write down what I did. Um, it's always nice to have some kind of social support if it's possible, or to join some virtual exercise classes. However, that comes with a warning that a lot of times these virtual classes are not always safe for you. So that's why I first put in the disclaimer that, make sure you consult with your doctor or a cancer rehab specialist or somebody before you engage in these virtual classes. And safety first. Safety is always important. So if you feel like, oh, you know what, for instance, I'm going to tell you to do maybe an exercise like sit to stand, but you feel like you have poor balance today and you cannot engage in that because you have a lot of neuropathy due to the treatments you have received, or it could be just because of weakness, then that would be something you would decide not to do. And there is always an alternative. If you cannot do that, there is always something else we'll be able to find for us to do. So we'll talk a little bit more about that when we get to the exercise part. I like using this scale. So I pulled this up and it seems really complicated and there is a lot on it, but let's just go through it. It's actually pretty easy to understand. The RPE scale is known as the rate of perceived exertion. So basically this scale correlates, believe it or not, to your vitals. So it kind of is a guide for you without using a blood pressure cuff, without using a heart rate monitor, what is safe and what is not. Let's start from the beginning. So 0 is rest. That is, you're lying down, you're resting, you are actually doing absolutely no physical activity. So that is 0 on the RP scale right here. Number 1 and number 2 is very light. That means you are sitting now at the edge of your bed or in a chair watching TV or being a passenger in the car. Then 3 to 4 is moderate. This is where we want to be. Moderate intensity is highly recommended by American Cancer Society, and I'll talk about that. So, what does moderate mean? Moderate means that you can carry a complete conversation and not be out of breath. So there is no shortness of breath. You can carry a complete conversation while you're doing your physical activity. So, for instance, I am walking and I have a friend with me, or significant other, and I am able to have a full conversation while I'm walking, and I don't feel winded. That would be moderate. If you then 5 6 is becomes somewhat hard. Now you're you know what, I cannot have a full conversation, but I can have a short conversation, and I am feeling that I'm getting a little bit out of breath. That would be somewhat hard. You can have short conversations, but you are feeling kind of out of breath. 7 to 8, we do not want to go there. So the reason is it's considered hard. And especially with metastatic breast cancer, we are trying to conserve our energy for other activities in the day. So we do not want to ever exercise at this hard level. What does hard mean? Breathing is now labored, right? You can speak short sentences, but cannot carry a conversation during while performing the activity. So let's go back to our walking recommendation, right? According to American Cancer Society and American Heart Society, what they recommend is about 150 minutes of moderate intensity aerobic activity and 2 times a week of strengthening, 2 to 3 times a week of strengthening. Moderate intensity. So, moderate intensity can be different from each and every one of you, including me. So, what is moderate for me may not be what's moderate for Erin, even. So, let's keep that in mind. So let's go back to our 10 minutes. What does 150 minutes mean? It means about two times a week, maybe 20 minutes, and maybe 3 times a week, about 25, somewhat in that zone of walking or aerobic. So it can be anything if you are doing a lot of activity around the house, moving around, or if you have a stationary bike and that's what you use, it all of that counts. I would say that in the morning I get up, and today, it's been a pretty good day. So I go ahead and I walk for 5 minutes. But after 5 minutes, I start getting winded. I have difficulty having a conversation. I would cut it off. I would put a clear, hard stop at that point. But I would take out my little book, something like this, and I would write down 5 minutes, 9 a.m. I am now tired. I want to have my nap. I go ahead and have my nap. I get up in the evening after my nap, about 3 or 4, and I'm feeling like somewhat energized. So now I'm going to go ahead and have another walk. And this time I could do 10 minutes. Well, guess what? You already got 15 minutes. So it is 150 minutes per week. Rome wasn't built in a day. We are going to slowly achieve that goal. So week 1, you might just do 70 minutes. Week 2, you might do 80. You are having a really rough week, you might slide back to 70. And all of it is okay. So remember, this journal is just so that you can keep track and see how your fatigue levels improve. I did put this in there for some of you who do like to measure your vitals. And I did want to bring this up too. The safe resting heart rate for exercise is below 100. So your Apple Watches do that calculation for you. Now, a lot of you undergoing treatment, and I know from experience itself that a lot of patients who come in to see me have a resting heart rate sometimes above 100. At that point, I always call my doctor, right? I call the patient's doctor, the oncologist, and then I will get medical clearance. Most of the time, they are going to tell you it's okay. Even though your resting heart rate is about 100, it's still okay. But, then I would go back to the RPE scale. And if I start feeling chest pain, shortness of breath, all of those above things I talked about, I would stop the activity. But always get medical clearance if your resting heart rate is above 100. Now, your resting heart rate every day when you get up and you rested and you take that pulse and you find, okay, you know what? It has been 100. It has been 102, 110. Suddenly, one day you get up and you find that your resting heart rate is like 120. So it went from 100 straight to 120 for a couple of days. Guess what? It's time to call the oncologist. All right. So I want to make sure you practice safety while you're doing these exercises. Why? I don't know. It could be pleural effusion, could be a variety of other things. We just want to get clearance from the medical doctor, make sure they don't want to do a follow up with you. Similarly, for blood pressure, for strengthening, the safety value is 160 over 100 and medical attention for 180 over 120. Now, if your blood pressure is 160 over 100 and you have chest pain and shortness of breath, I don't care. Call the doctor, right? So these are just guidelines. They are not written in stone. And feel free to put questions because this is a lot of information I just threw at you. This is a chart I like to use, and it's not necessarily applicable to you. But it is a chart which we have taken from American Institute for Cancer Research. And it is talking about cancer risk and how it's higher with inactivity or the reoccurrence of cancer. The reason I put it in is I like the way it shows the benefits of exercise and physical activity. For instance, Anne, right? So we talked about sitting and not moving at all. It is considered sedentary, right? And then if you look at Mike, yeah, he has a little bit of exercise in the day, but then your Mike is also doing, brushing his teeth. He's able to walk, and that little thing is the yellow. So you can see overall this whole circle, he is doing a lot of what we call exercise or physical activity combined, right? So that's a good scale. Kim here has preference for more physical activity than exercise. Is that okay? Completely okay. So while you're logging, oh yeah, this was like a busy day, grandkids were over, I spent a lot of time playing with them, put that in. It counts in your log. Remember, 150 minutes of movement, 2 to 3 times a week of strengthening. All of it counts. And here we have Joe, who really likes physical activity. So he's actually doing pretty good, even though his exercise is pretty much the same as Mike here, but he's doing a lot better than Mike. So basically, the bottom line is if you keep moving, you're doing good. And I did mention that track your progress. This is just one example, which we commonly use, but you don't necessarily have to use the same chart. It's a little bit complicated, but we have like a step count, and then the kind of exercise, cardio, resistive training. There is balance and flexibility, which with caution, and I'll talk about both of that in a little bit. And then the type of activity, how long, which is very important because we are trying to do this weekly thing. You don't need to put in main muscle groups over here. That could be a little challenging unless you have that background. And what kind of things they did. They did 60-minute circuit workout. Some level of log. Even if you just put in the date and whatever you did and how many minutes, that would be fine. This will help you track and monitor your progress. And if you go to a cancer rehab specialist or you go to an expert, it will help them figure out where you are so we know where to progress you. So the other thing I would like to emphasize, and I have patients on all stages of cancer, so I know this very well, make slow, gradual changes over time, right? So set one goal. I had a patient, I'm going to give you an example of Ari, my favorite patient. And so Ari came in, metastatic cancer, not breast, but nevertheless, it was kidney cancer, and there was mets to the brain eventually. However, when Ari came in, he could not get up from the chair. That was his biggest challenge. He was using a lot of his arms to get up from the chair, and he was also having a lot of trouble with bed mobility, that is getting in and out of the bed. So the first two goals we set were just that, get in and out of the chair, and let's have you independently get out of bed. achieve those goals, and then we get to the next. So you see, Rome wasn't built in a day. Take baby steps, and eventually, you can kind of go into more advanced goals. And I did mention that several times, but this is even more important. So let's take a pause and talk a little bit about why, if you have mets to multiple sites like the bone and the spine, or anywhere in your body, like for instance in your femur or your thigh bone, you do need to get on a supervised program with a cancer rehab specialist, a physical therapist, or an occupational therapist specifically, and get clearance from your doctor. The reason being, the risk of fractures is a lot higher, and it's a very unstable joint at times. Um, Having said that, the biggest risk would not be so much walking, and I even say that with caution, but walking is usually okay. The bigger risk would be actually stretching, believe it or not. For these patients, for instance, if you have mets to the thigh, you do not want to do a thigh stretch, because to go through extreme range of motion, you're compromising the joint and might just snap the joint, if that makes sense. For instance, if it is in the spine, you do not want to go fully backwards, because you're going all the way back, and guess what? The joint is unstable and it could snap. So the safest thing would be mid-range. So for instance, if I want to pick up something, I would not bend all the way forward, right? So I would be okay bending a little bit. There's no harm to that. Just don't go extreme range of motion, which is what stretching does. So that's why today, when I'm going to present, stretching is great for relaxation. It is great, when you have a lot of tightness and stiffness. But maybe based on the site of meds, it may or may not be safe to you. So then you would go to a PT. A lot of times, and I'm not going to read through what a physical therapist does and what an occupational therapist, but the big difference between a physical therapy and occupational therapy would be, and I'm going to explain, is like physical therapists deal with big movements. For instance, they help with your walking. They will help with your balance. If you have weakness in your arms and legs, that physical therapist would be your choice. Um, and just generally for combating fatigue, I would say physical therapist is a little bit more of an expert, not saying that an occupational therapist would not be able to do that. And overall, both physical therapy and occupational therapy, our goal is to improve your quality of life. Now, this is where slight difference with the occupational therapist. If you are struggling with activities of daily living, for example, I am a physical therapist by trade. I'll take you to the bathroom, right? But then you're struggling combing your hair, or you're struggling, doing braids in your hair, or you're struggling buttoning up your shirts. Those little fine motor skills or activities of daily living, an occupational therapist probably would be more of an expert. Not saying a physical therapist cannot do this. So I guess it does get a little complicated. Energy conservation is another one, which both can do it, but a little bit more tricks of the trade, so to speak. You can get more from the occupational therapist. Cognition is something a physical therapist cannot do. So you know how they say the chemo fog, or just kind of trying to, you're forgetting things because of all the medications, having trouble remembering your appointments, and those kind of things. That is more of an expertise with the occupational therapist. And then if you have any questions on the difference, you feel free to, put it in the chat box. Well, that kind of wraps up my presentation. I covered a lot, and I do have this tendency to speak very fast. And so I'm going to take a little pause, and I'm going to let Erin or, kind of go through some of the questions in the chat box if there are any.
So we don't have any questions quite yet, but please feel free to put your questions in the chat or raise your hand. We have a smaller group, so you're welcome to come off of mute. But what I will say, Rita, is I'm glad that you clarified between exercise and physical activity, and and reassured us that both contribute to mobility, our weekly minutes. I think that that's really an important point. I know that's teaching for me as well, because I'm always thinking designated exercise is really what we're looking for 150 minutes. But you're right, if there's other activity that you're doing just as part of our day to day, that provides a benefit also. So making that point, I think, is really helpful.
Yeah, I totally agree because, it's so easy to get like, okay, I had a busy day and I have been from appointment to appointment and I come home and I'm feeling defeated. I didn't do anything. Guess what? No, you did. Every time you got in the car and you went, through the parking lot to the appointment, that was all physical activity and that goes into your little book. So you should feel happy on those days that you don't have to come home and do, whatever the with like 10 reps of a bicep curl. So it's not all about that. And sometimes I'll be honest, um, working through a functional activity is actually even better because it lets you come back to, the things you love. For instance, like I want to go back to Airy. Yes, we did have some exercises, designed to help him get up from the chair. But actually, the one thing which I kept making him do over and over again was getting up from the chair. So you see my point. The more you incorporate function combined with exercise, the better chances you're going to get back to the things you love. So, and I think that's where sometimes the expertise of the cancer rehab specialist comes into play, who can guide you through that process.
Right. Yeah. And we always recommend, especially for those that are starting off, to make sure you're getting the clearance. And if you can, work with a professional, at least in the beginning, so they can set you on the right path. You know what safely to do, you know what to avoid, and you're reducing risk of injury, like you said. So
Yeah.
so I love that. Okay. We did have a question in their chat. Are there recommendations for online or book resources to provide a safe guided physical movement program? It's likely going to be hard to find a specialist. This person lives in a rural area. I get it. Mostly they walk. They have bone and spine mets, would of course check with their oncologist. But I love that question. Do you have any good resources, Rita?
So the research, the sad part is with metastatic breast cancer, it's just harder to come up with resources just because there can be so many complications. So what I would do in that situation is I would the thing is that like I don't have a problem at all talking to this patient and setting up like a Zoom call. I can do that for her, or
Hmm.
and that would be completely okay because again, meds to the spine, that's broad. Where exactly are the meds to the spine? Is it in the upper back? Is it in the lower back? And saying meds to the bone. So where is the meds to the bone? Is it in the thigh? So no matter what research you look at, you are going to begin to find like it's getting a little bit complicated. What I would focus for you would be function. So I would do the walking, and then I would do safe activities, mid-range movement. Like for instance, if you're doing like a sit to stand, that would be safe. Today, pretty much what I'm going to give you, unless there's meds to that joint, is pretty much safe. So that would be a good place to start. I'm going to say again, how you feel the next day. I forgot to mention that. So when you're doing an exercise program, and supposing the next day you feel, oh, you know what? I walked, but now I cannot get out of bed. I can't even go to the bathroom. I'm that tired. Guess what? You did too much. So remember to monitor yourself even the next day. I would advise start very, very slowly and then, increase your activity level. I will find some resources, Erin, and I will provide them to you. If you go to our website, there is a lot of resources, www.revitalcancerrehab.com. And you're going to find a speaker series and different kinds of resources. So feel free to go there too, but I will send you specific resources too. later on.
Perfect. Yeah, and we'll be sure to include that with the recording as well. We had
Great.
another great question, and Rita, I'm going to stop sharing your screen just so that we can
Oh
see
yeah,
you before we get moving a little bit.
yeah.
Interested in your thoughts on yoga and stretching. Yoga is often recommended for cancer patients. Is it okay with MBC and bone mets? I love that question as well.
Yeah, and I have particularly myself done some yoga classes. So I'm going to have to say it could be unsafe at times. So for instance, the cobra position in yoga, which is very common. Remember I talked to you about spinal mats and not going through that extreme range of motion? I would play be a little cautious about that. Tai Chi is actually a little bit better than that. So that would be more safe. And Teresa just put it in the chat box that she knows of some resources. Teresa, if you want to come off mute, feel free to address that.
Some virtual programs. Yep.
Yeah. Yeah. So there are some um, online virtual programs that are um, guided by on like exercise physiologists who specialize in helping people with cancer. So they know the right questions to ask. And I work with Rita. And so I can help share some of those resources with her. So they threw Rita's email in the chat for anybody who wants to get a hold of some of those online resources that we know are kind of guided by exercise physiologists who understand some of the special concerns that people that are working through cancer have. Then she can help you connect you with some of those resources.
Perfect. Thank
The
you so
same with
much.
yogas. I think yoga is a fabulous exercise, and there are, as long as you have the right trainer and you know personally what you need to do for your body, yoga can be fabulous because it is so whole body care. You just have to be very careful and make sure you have the right trainer
Right.
to make sure you're doing the right things for you.
And I think that that's a good point, and why yoga is part of our passport program that we offer, and even available to those to all of us. We have a really comprehensive yoga video library, but all of our providers are oncology trained, and they know those questions to ask. And if you're looking to start a yoga routine, that can be a great place to start for many of the reasons that Rita and Terry have shared, in that they can let you know, right, a full back bend, a cobra would not be safe for you. We often hear downward dog is not safe because of that pressure for those in the upper extremities. So understanding the safety behind those movements and working with a professional, like they both mentioned, is really key.
Mhm. Yeah. Thank you,
I
Terry.
love that.
Yep.
Sure.
Thank you. Okay, we'll take one more question and then we'll get moving,
Mhm.
Rita.
Yep.
So our next question: I'm recovering from mastectomy, waiting for reconstruction, recently started exercising and noticed getting some pain in their chest area a few days after. Does this mean this person is doing too much?
Pain after a mastectomy can be normal. I don't want to say it cannot. Having said that, what kind of pain is this person experiencing? So if it's like chest pain, sharp shooting chest pain, I would definitely put some caution to that. But having to say that, pain just, because after surgery with all the healing process, scar tissue, maybe even lymphedema and pressing on those nerves, pain could be expected. But most of the time, I would say yes, the person is doing too much, because what the recommendation is to do exercise, which are actually pain free. So the next day, you should not feel any, you might feel muscle soreness, and that is okay. The difference between pain and muscle soreness, right? Like slight amount of muscle soreness is very, very valid. But to feel shooting pains of any kind, that would not be normal.
I love that, again, I love that call out of soreness versus pain. I
Right.
think sometimes if we're getting started on something, that soreness can feel like pain, but it's a normal part of muscle use and recovery. So just
Mhm.
calling that out on how to differentiate between the two.
Right. I
Okay.
did see one question in there, and
Yeah.
I will rush. I guess we have enough time. I think someone was asking about neuropathy. So with a lot of the chemo drugs, a lot of patients do have numbness and tingling, and different sensations in their arms and in their hands and feet. That would not mean that you cannot exercise. So I want to make it clear there are specific exercises, and I think I have done a presentation on neuropathy. So if you want to go back in there and look through that presentation, there are specific exercises which can help. For instance, if it's in the feet, and most of the time, very rare, I would say, there is any meds to the feet. So just doing like a little bit of a toe stretch would be great. Or doing like a foot roller would be very, very good to help with the neuropathy. Like what I say is buy something from Amazon, put it in a freezer, and do a little 2-3 minutes of a foot roller, which will give you that massage, which really feels good. And along with that, will help with the neuropathy. But yeah, exercise with neuropathy is okay. You just have to be careful that if you have too much neuropathy, it might affect your balance. So make sure if that's the case, then you are always near a kitchen countertop or you have something to hold on.
And balance is something that a person could work on with a physical therapist and occupational therapist. So we've done a segment on balance as well, and I'll pop the links for the neuropathy segments with Rita that we've done in the past as well. But that was really eye opening to know that balance alone, especially related to neuropathy, is something that can be worked on. So know that if that is your biggest challenge, you can find some benefit to it.
Right. So now I'm going to get into some exercises. The first one I'm going to teach is actually is helps you relax, and a lot of times it even helps you lower those elevated heart rate or even blood pressure, and I use it frequently in the clinic. It also helps your lymphatics because the right thoracic duct, it actually lies in the diaphragm. So the first exercise is known as diaphragmatic breathing. You're going to put one hand on your chest and one hand on your belly, right? So when you breathe in, you are going to expand your belly. Your belly is going to blow out like a balloon as you breathe in. And then with pursed lips, count of 4, exhale. Okay? Usually I say 10 times. So breathe in, expand your belly. That was 2. So breathe in, expand your belly. That was 3. Breathe in. That is 4. 5. Everyone feeling relaxed? 6. 7. 8. 9. And I cannot tell you how many times in the clinic I've had patients come in. I see their blood pressure like 160 over 100, their heart rate 105, 110. And we are thinking, all right, they are saying, oh, I guess we cannot exercise. I said, no, we're going to do the diaphragmatic breathing first. And as soon as we start, it does lower it significantly, sometimes even. So it's safe for every single person today. So let's at least start with some breathing exercises. Extremely good. The other thing which does help reduce, which I'm going to say, like, definitely use caution, is stretching. I usually, when I have patients with elevated vitals, I have them do diaphragmatic breathing and stretching. So it doesn't, and again, the stretching has to be monitored. Again, we have already gone into that. But I can tell you, even on those days, you can still exercise. And I call it sometimes a day of just movement therapy. We just go through each joint, which is stiff and tight, and do mid-range movement. Suppose I'm going to show you the next thing which we're going to do, which helps with relaxation. Just some shoulder rolls. Okay, I'm just going to go backwards. 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. So again, I'm going to now go into what we call, it's not technically strengthening, but it is the beginning of strengthening. So at this point, we are not using any weights, but we are going to do some bicep curls. Just having treated metastatic breast cancer a lot, I can say for most of you, this is considered safe. All right. However, if you have mets to your bones, again, that same formula follows. Would I not do bicep curls? I would. I would just not go through like the full range of motion. All right. So basically, supposing this is full range of motion, this is considered full range of motion. That means I cannot go any further. So I would start off right here, whatever my arm allows me, right? And then slowly go up to the point where I feel comfortable. If you have mets to the bone, you can stop. If you don't, you can go all the way in, right? And then you go again, straighten your elbow all the way, and then go all in. This is 2. Okay. Then go straight and then go in. This is 3. This is 4. This is 5. 6. 7. 8. Mm, 10. Now, depending on where you are, this is the time to monitor your RP scale. Remember, I talked about it. Any of you feeling really tired? Guess what? Don't be hard on yourself. Sitting and listening to me for an hour is exhausting, right? My husband, ask my husband, right? I am not easy. I keep on going on and on. So if this is your burnout point, so be it. If you are beginning to feel exhausted, you are feeling like if you had to talk, you would not be able to have a full conversation, just relax and go back to diaphragmatic breathing, right? So everyone is different. Now, the next one is also pretty much safe. And I've selected today exercises which are pretty much safe. So this is known as an abdominal brace. This is very critical because we need to recruit our abdominals for pretty much every single activity of daily living. For example, getting out of the bed, you are going to need to engage your abdominal. To get up from the chair, you're going to need your abdominals. All right. So how do we do that? So if you think of your belly button, right, you go ahead and press, like you suck it towards your spine, suck it in towards your spine. And then you hold that for about 5 seconds. But guess what? Do not hold your breath as you're doing it. So the fact that I'm talking to you, that means I'm not holding my breath, right? So I've held this for about 3 to 5 seconds and then slowly relax it. So that was 1. Please. Now remember, we are not moving your spine, so it's pretty much safe for all of you. Right? I'm actually doing the exercise. Held it for about 5 seconds. Let it go. 2. So if someone tells you while you're doing this exercise, you are not exercising, say, Rita said I am. I'm sucking my belly in and I'm doing 10 of these. All right? And you feel the work. You do. So that was 3. 4. 5. We're on to our 7th. Go in, suck your belly in, hold it for a few seconds, let it go. Now we are into 8. Go ahead, suck your belly in, hold it for a few seconds, and let it go. Now we are on to 9, right? And then let it go. And your last one. All right. How is everyone doing so far? Good? Still ready to go on and keep moving? Yeah. So the next one would be, again, showing you things which you can do throughout the day. Remember, you don't have to do them all together if you cannot. So right now you're watching TV and you're like, okay, I feel like I'm totally energized and I want to do a little bit of something. So we have handled a little bit of the arms. We have done some bracing. We're going to go to the legs. Just do some knee kicks. All right. So remember, again, go mid-range. Do not extend your knee all the way if you have any kind of match to the bone. So I am going to count. So one knee straight, then the other knee straight. That would be 1 repetition, right? Knee kicks. So let's go to the second one now. Extend your left knee halfway. Extend your right knee halfway. That is 2. Okay. Extend your left knee halfway. Extend your right knee halfway. That is 3. Extend your left. Extend your right. We are on to 4. Extend your left. Extend your right. We are on to
Rita,
5.
while we're doing this, I have a question. I love this.
Yeah.
But if someone has like ankle weights, 1 pound ankle weights, is that progression for them with something like this, or even a lightweight doing our bicep movements? Would that be a safe progression?
Yes. So if you're already doing like ankle weights and next day you're not feeling too sore, you're able to do all your activities of daily living, I would not go backwards. If I feel like I can use 1 or 2 pounds, it is pretty safe. In the sense, like as long as you've already been exercising. For instance, if you're starting a new program altogether, and you start off with 1 or 2 pounds, I would say start off with nothing then, and then increase the repetition. So that would be a safer route. So for instance, I have never used any weights in my life and I start using weights. So that would be just too much. So and for those patients, I would say just don't use any weights. Try 10 repetition for the first week. You know what? I feel great. I am not sore. I am not affecting my day-to-day activity. I'm able to go to my doctor's appointment. Next week, I'm going to try 20. Hey, that's going pretty good too. So now I'm going to try that 1 pound weight. So that's how I would progress, monitoring how I feel the next day. I think by now all of us should have finished the knee kicks. How does everyone feel? Everyone feeling still good? Still with me, right? Now, at this point, I'm getting a little bit into some standing stuff. So for those of you whose balance is affected, make sure you have something to hold on or choose not to do the next series of exercise. The one I'm going to do next is a little bit challenging for most people. So what we're going to do is we are going to do the sit to stand. We are going to bring things together at this point. Always, I like to do an exercise and then combine that with some kind of function. Remember, I taught you to recruit your abdominals. I want you to recruit them. I want you to tighten up your abdominals. And then we are going to use our thigh muscles and slowly stand up. Now, if you need to use the armrest, feel free to do so. It's completely okay. So I would stand up all the way up. This is safe. It's not harming you in any way. And then I would slowly sit down. So that would be my one repetition. I'm going to say, if any, compared to anything else I've done today, this might make you sore. So if you have never exercised, just do 5 today. And then for this week, do 5. Next week, start doing 10. All right? Otherwise, I'm going to go through 10. So I'm going to tighten up my belly, recruit your belly. If you want to use your arms, feel free to do so. And then stand all the way up. All the way up, and then all the way slowly down. Right? The other way to make this exercise okay for you would be to put a pillow or a cushion or increase the height of your chair, right? And make sure you're not fully at the back. So come to the edge of the chair, right? That will increase your momentum. You'll be able to, it's a lot easier than if you were to start off from behind or use a chair which is low. So we did 2. We are on to the 3rd. All the way up, and then all the way down. Nice. We're going on to 4, all the way up, and then all the way down. Very nice. Going on to 5. I'm slightly building up some speed here because we only have 5 minutes left, right? 5. So this week we're doing 5. Next week we might be doing 10, all right? Now, the next thing is again in standing. So remember, when I showed you that chart, sitting is less stressful on your body than standing. So first get used to the sitting and then go into standing. When you're standing and doing these next series of exercises, make sure you have something to hold on if your balance is compromised. If not, you're going to stand. You can go behind your chair. I'm not going to do that because you won't be able to see. Go behind your chair, hold on to your chair, and let's do some marching. 1. Okay, so that was 1, 2, 3. I am marching, see? 4, 5, 6. I was pretending to hold on the chair the entire time. 7, 8, 9, and 10. And anywhere in the game, if your RPE scale is now getting 5, 6, please stop, right? Now, the next thing I'm going to show you, I'm trying to give you a little bit more functional stuff. This is something which we don't have to do it right now, but hold on to your kitchen countertop and just walk around it. That's it, side walking. It recruits different muscles. It will recruit some of your hip muscles, and it's absolutely safe. So you would hold on to the kitchen counter and walk around it. That's what I tell my patients to do. It is exhausting, believe it or not. Those muscles, my patients say, I never walk sideways, and I realize I have muscles I never knew I had. So that's what you're going to start feeling. And people ask me, how do you progress this? Well, guess what? If you're in good physical condition, you can put one of those resistive bands and we can, tie it around your legs, and then you would be moving sideways that way. And that concludes my little mini exercise session. Do you
I
guys?
love that.
Yes. Someone asked me, are squats, actually squats would be definitely a great exercise. And if you, they can be an alternative to stand sit. And the added benefit is if you have a wall Or if you have a ball, one of those exercise balls, if you put them behind your back and put it against a wall and do just tiny mini squats, guess what? This is safe for you because your back is nice and straight and you are just doing tiny squats, which is not putting a lot of stress on your joints. So yes, absolutely it is.
I was thinking even the marching that we were doing, Rita, even to help with balance, just holding it
Yeah.
for 3 to 5 seconds, if a
Mm,
person feels like they've been
yeah.
progressed to that, can help. So this is, I think all of these that you shared were just really great foundational movements and a
Yes.
good reminder. And I love the bracing that you were talking about, reminding us to breathe, because I held my breath the first time and it's like, okay, that's not the point. We want to
Yeah.
keep breathing through it. So having those reminders from you, I think, is really helpful.
Yeah. As someone who has medicine, lungs, low oxygen level issues, and recovering from PV and DVT and 2 fractured ankles, you are given. Oh, thank you. I really do appreciate you. Someone who has medicine, lungs, you said about oxygen levels, so let me mention and throw that in. Oxygen levels for exercise have to be about 90%. About 90%. So make sure if
Okay.
you're below 90%, you are not safe to exercise. What can you do something? Yes. Go ahead and start doing some diaphragmatic breathing. And actually there are more breathing exercises. And I would be happy to share them with you, Erin, and you can share with them.
Perfect. Yeah, that would be great, Rita. Well, we cannot thank you enough for being here with us.
Thank you.
Uh, Always learn so much. You're getting rave reviews in the chat. We are so grateful for the information that you shared, the
Yeah.
safety reminders that you instilled in all of us. And I think just reassuring that we can all do something. There's always modification and the benefit of any sort of mobility. So thank you for your time and your thoughtfulness and being with us. And your colleague, Terry, thank you for jumping right on in and sharing those
Yeah.
resources as well.
It was a pleasure and an honor. Thank you, Erin.
You're welcome. So
Awesome.
we have this recorded, and we'll get this on the library for everyone to tune back in and rewatch, and we'll share those resources as well.
Wonderful. And of course, again, our virtual education and our UFH Connect would not be possible without the support of our sponsors. We have West, Merck, Lilly, Novartis, and Gilead Sciences. Support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and our supporting sponsors, AbbVie, TerraSera Therapeutics, and Verastem Oncology. We look forward to our next UFH Connect events. We hope to see you tomorrow at 1 p.m. Eastern for our Side Effects Ask the Experts, and then Friday, November 7th at 1 p.m. Eastern for Oncology Massage.
Wonderful. Well, thank you. Yes, hopefully we will see you tomorrow. Thank you, everyone, for joining us this evening. Rita, Terry, thank you again. Everyone have a great night, and we will see you again soon. Take care, everyone.